Hi, my name is Mara Sierra and I'm from Houston, Texas, and this is my audience. In the Houston, Texas area, there's only two level 1 trauma hospitals, one of them being Memorial Hermann TMC. We see over 40,000 patients a year, and we have over 21,000 employees. With so many different things going on, there has to be a game plan in place to make sure we're improving processes, creating a high quality and effective product for our patients, and also at the same time promoting specific things that God values, such as relationships, honesty, and justice. As the Bible says in Luke 8:15, but as for that in the good soil, these are the ones who, when hear the word, hold it fast in an honest and good heart, and bear fruit with patience and endurance. Today I'm going to discuss the role of a Six Sigma director in the healthcare industry. Although I'm directing this to the healthcare industry, Six Sigma is a process improvement that can be used in any different industry and in many different process improvement plans. I work at Memorial Hermann. I've worked there for 5 years, and I've recently been on the pit crew for a Six Sigma process improvement. The director of a Six Sigma program has her duties are not their duties is not limited to, but include improving patient services, increasing staff effectiveness, and enhancing organizational flexibility in a changing landscape such as healthcare. First, let me discuss the improving patient services. When I interviewed with Jean McBride, who's the director of Six Sigma, one of the directors of Six Sigma at Hermann, she discussed with the importance of a value add. That there has to be enough of the value add to make a product effective and wanted by the customers, that they will buy into it. And one of the ways that we can do this is by improving our processes in regards to the patient safety. Two of those big things for patients is going to be for their time quality, that we have taken time, that we're not taking more of their time than we have to. One of the ways we worked on doing that is by ensuring that their surgery time and getting ready and having to get in there and wait is less than it used to be, and less than it is in other hospitals up and down Fannin, which is where the Med Center is. The other way we are improving this and are looking into making process improvements is ensuring that we not only have a safe but high quality product we're giving them, in regards to the fact that everything is at the cleanliness and safest that it can be, that no patients are harmed, and that infection control is limited as much as possible. Next, I'm going to talk about increasing staff effectiveness. The objective of Six Sigma is a measurement-based strategy through process improvement. And when it comes to staff effectiveness, this is looked at as everyday duties that the staff does is broken down to the most minuscule act in order to make sure that time is not wasted, that these actions are actually needed, or they could just be done away with, or that ensuring that they have the tools and resources they need in order to do their job both effectively and with quality. Also, the last part of that is making sure that we take that in a big hospital, it's very easy to overlook the staff, and we want to make sure that we're not burning employees out by giving them too many duties to take care of, that it's not possible for them to handle all of those, or that their time at the hospital isn't being wasted in doing things that don't necessarily need to be done. Lastly, I'm going to discuss enhancing organizational flexibility. With the Affordable Care Act and other parts of it, the Cadillac Act that's going to be coming into place this next year, it's imperative that we have process improvements in place. These are needed in order to look at saving money, making sure our infection rates are down, and making sure that we give effective, high-quality product to the patients so that people will choose to come to Hermann. The biggest part of this, I believe, and a huge part of this is the key to this is leadership. In Maxwell's book, he says, the higher you want to climb, the more you need leadership. The greater impact you want to make, the greater influence you need to be. His book discusses all the ways that leadership can lead and how you have to have followers in order to lead. And I think that's a big part of this, and that's one of the things our hospital does really well is our leadership is ready and encouraged to change. What worked for us yesterday might not necessarily work for us tomorrow, because healthcare is always changing, whether it be because of policies that are handed down from government, or it also can be from different diseases that are discovered, or growth of a certain sickness. We have to stay on our toes and we have to stay ready, and the best way to do this is to work with a Six Sigma group. The Six Sigma Academy actually states that they're black belts, which is a level of their attainment of learning. They can actually save $230,000 per project, and a Six Sigma director at that level would be able to do 4 to 6 projects a year. When you add up those kind of things, you can definitely see where the quality and the need for these people comes into play. So today I discussed with you the role of a director of Six Sigma in a healthcare industry. I hope that I explained how they're able to improve patient services, increase staff effectiveness, and enhancing the organizational flexibility in an ever-changing healthcare environment. I thank you for letting me talk to you today, because it is definitely something I have found passion for. 2008, when I kind of fell into this job, I had no idea where it was going to take me. However, now after being a part of this pit crew and the Six Sigma group, and interviewing Gene McBride and doing my research on this, I truly feel like I now know what I want to do when I grow up. Thank you again for your time. It's been an honor.